Leg swelling isn't just an uncomfortable inconvenience in daily life. It can also be a sign of more serious underlying health issues, such as heart failure, impaired kidney function, or poor circulation. What may surprise many people is this: diet, especially fruit, can silently make the condition worse or, if chosen wisely, help improve it significantly. In today's video, I'll be sharing with you a list of 3 types of fruit that may seem healthy at first glance, but can actually worsen leg swelling. And on the flip side, 3 powerful fruits that can naturally reduce inflammation, support circulation, and help the body eliminate excess fluid. This information is not only based on clinical experience, but is also backed by research from respected medical organizations. So, if you or a loved one are experiencing leg swelling, heaviness, or discomfort while walking, please watch this video all the way through. And don't forget to click like if you find this topic helpful. Hit subscribe so you never miss our expert health advice, and share the video to help someone else take a step toward better health. Let's begin with the first fruit that people with leg swelling should avoid, because it may quietly make your symptoms worse. Number 1, overripe bananas. Bananas have long been considered a nutritious, easy-to-digest fruit, often recommended for older adults due to their soft texture and digestive benefits. However, for seniors dealing with leg swelling, which is commonly caused by declining heart, kidney, or vein function, overripe bananas can actually act like a double-edged sword. This is primarily due to their high potassium content in certain natural compounds that can exacerbate water retention and swelling when not managed properly. On average, a large ripe banana, 120, contains around 422 milligrams of potassium, which is nearly 9% of the recommended daily intake for adults, according to the National Institutes of Health, NIH. In healthy individuals, potassium plays a critical role in fluid balance, blood pressure regulation, and nerve function. However, in older adults with even mild to moderate kidney impairment, often a result of aging or chronic conditions like high blood pressure or diabetes, the ability to excrete potassium through urine is significantly reduced. In such cases, consuming potassium-rich foods like ripe bananas can lead to hyperkalemia, a condition that increases the risk of irregular heartbeat, muscle weakness, and more critically, fluid retention in the lower limbs, causing or worsening leg swelling. Additionally, overripe bananas contain a high amount of natural sugars, including glucose, fructose, and sucrose, averaging 14-15 grams of sugar per 100 grams of fruit. This sugar load can spike blood sugar levels, particularly in individuals with insulin resistance or diabetes, leading to compromised capillary function and poor peripheral circulation. As a result, fluid buildup in tissues worsens, contributing to more pronounced swelling in the legs. A 21 study published in the American Journal of Kidney Diseases emphasized that high potassium diets in older patients with an estimated glomerular filtration rate, eGFR, below 60 mmol were associated with a significantly increased risk of edema and blood pressure instability. This further supports the recommendation that seniors with leg swelling or declining kidney function should closely monitor potassium intake, with overripe bananas being a key source to reconsider. In summary, while ripe bananas may be harmless or even beneficial for healthy individuals, they carry potential risks for seniors dealing with leg swelling. Rather than eliminating bananas completely, it's best to consult with a nutritionist or healthcare provider to adjust portion sizes appropriately and consider substituting with lower potassium, lower sugar fruits that better support circulation and reduce fluid buildup. Now let's move on to the next fruit that may seem healthy, but could silently worsen leg swelling. 2. Ripe mangoes. Mangoes are a tropical favorite for many due to their rich, sweet flavor, smooth texture, and high vitamin content. But for older adults facing leg swelling, often the result of circulatory issues, fluid retention, or reduced kidney function, ripe mangoes are not always the best choice. The reason lies not only in their high natural sugar content, but also in their potential to disrupt electrolyte balance and trigger low-grade inflammation, which can intensify swelling. On average, 1 cup of chopped ripe mango, AA165G, contains about 45 grams of carbohydrates, with approximately 31 grams coming from natural sugars, primarily fructose and glucose. USDA Food Data Central. This sugar load is significantly higher than in many other fruits and can cause sharp spikes in blood glucose, especially in seniors with insulin resistance or type 2 diabetes, a common condition that contributes to microvascular dysfunction and fluid accumulation in the lower extremities. Furthermore, excessive intake of sugar, especially fructose, has been linked to elevated uric acid levels in the blood, which promotes tissue inflammation. A 2010 study published in the Journal of Clinical Investigation showed that fructose activates the mTOR pathway and disrupts endothelial cell function, both of which contribute to peripheral edema. This helps explain why people with chronic inflammation or leg swelling are often advised to limit high fructose fruits like ripe mangoes. Additionally, ripe mangoes contain a moderate amount of potassium, around 277 milligrams per cup. While not as high as bananas, this still matters for those with compromised kidney function. When combined with mango's high sugar content and inflammatory potential, the overall effect can create a physiological environment that worsens leg swelling. A study published in Diabetes and Vascular Disease Research 2017 found a clear link between elevated blood glucose levels and increased tissue fluid retention in the lower limbs of elderly individuals with type 2 diabetes and mild heart failure, a population particularly vulnerable to edema. In short, while ripe mangoes are delicious and vitamin-rich, they carry hidden risks for seniors experiencing leg swelling, especially when eaten frequently or in large portions. A more effective solution is to swap them for fruits with lower glycemic indices, higher fiber content, and anti-inflammatory benefits. Now let's move on to the next fruit. Number 3, watermelon. Watermelon is a popular summertime fruit, often favored by older adults for its mildly sweet taste, high water content, and the cooling sensation it brings. However, for those dealing with leg swelling, especially individuals with issues related to the kidneys, heart, or blood vessels, consuming watermelon frequently and without moderation may unknowingly make water retention worse. While watermelon is commonly believed to have diuretic and cooling effects, its biochemical nature may not be as beneficial when it comes to lower limb swelling. To begin with, watermelon is composed of about 92% water by weight, which might seem helpful for detoxification. However, it also has a high glycemic index, GI, around 72, according to the American Diabetes Association. While it may cool the body, the natural sugars in watermelon, mainly fructose, about 6 to 7 genes per 100 grams of fruit, can cause rapid spikes in blood glucose levels. This is particularly concerning for older adults with type 2 diabetes, since prolonged high blood sugar can damage peripheral capillaries, reduce circulation in the legs, and lead to fluid buildup in tissues. Additionally, watermelon contains approximately 112 milligrams of potassium per 100 grams, according to the USDA. Although this is lower than the potassium content in bananas or mangoes, when consumed in large quantities, a large slice weighing 300-400 grams, the total potassium intake becomes significant. For those with impaired kidney function, this may lead to potassium accumulation, which can increase osmotic pressure in blood vessels, drawing water into the surrounding tissues and exacerbating swelling. Another important factor to consider is the osmotic load of watermelon, when consumed in excess within a short time. Because of its high water and simple sugar content, the kidneys must work harder to filter the excess fluid, while the heart and peripheral blood vessels also increase pressure to regulate body fluids. This may result in mild electrolyte imbalance, causing the body to retain fluid instead of excreting it, ultimately worsening leg swelling instead of alleviating it. A study published in the Journal of Renal Nutrition 2020 found that frequent consumption of high-sugar, high-GI fruits among patients with chronic kidney disease was associated with increased peripheral tissue edema and reduced filtration efficiency of the kidneys. In summary, although watermelon appears to be innocent and is indeed refreshing, it is a fruit that older adults with leg swelling should consume with great caution, both in terms of portion size and frequency. We've now covered 3 fruits that seniors with leg swelling should avoid or greatly limit: overripe bananas, ripe mangoes, and watermelon. While these are all familiar, nutrient-rich, and easy to enjoy, when introduced into a body with weakened heart, kidney, or metabolic function, they can promote water retention, trigger low-grade inflammation, and ultimately worsen swelling in the legs. But avoiding certain fruits doesn't mean giving up on the joys of fruit altogether. In fact, there are several fruits that are not only safe, but also act as powerful allies in reducing inflammation, improving circulation, and helping your body balance fluids naturally and sustainably. So now let's explore 3 fruits I highly recommend for seniors struggling with leg swelling, nutritional companions backed by science that help reduce inflammation, detoxify gently, and support cardiovascular health. Let's begin with one small but mighty fruit, the blueberry. Number 1. Blueberries. After learning about the fruits that may worsen leg swelling, you might be wondering, is there anything left that I can enjoy safely? The good news is not all fruits are culprits. In fact, some fruits are not only safe, but are especially helpful in reducing swelling, improving blood flow, and balancing fluid levels. One of these quiet heroes is the blueberry, a small fruit with remarkable nutritional strength. What makes blueberries stand out is their rich content of anthocyanins, a group of powerful antioxidants responsible for their deep blue-purple color and natural anti-inflammatory effects. For older adults with leg swelling, often triggered by mild inflammation, capillary dysfunction, or poor circulation, blueberries act as a natural calming agent for the blood vessels and surrounding soft tissue. Studies have shown that anthocyanins in blueberries can improve endothelial function, increase vessel elasticity, and reduce fluid leakage into surrounding tissues, all critical mechanisms in fighting edema. According to the U.S. Department of Agriculture, USDA, 1 cup of fresh blueberries, 148 g, contains only 84 calories, 21 g of carbohydrates, 15 g of natural sugar, 3.6 g of fiber, and is very low in sodium, a profile that's ideal for those managing blood pressure and fluid retention. Notably, a clinical study published in the Journals of Gerontology, Series A, 2019, tracked 138 older adults over 6 months of daily blueberry consumption. The results showed significant improvements in peripheral blood circulation, mobility, and reduction of chronic inflammation symptoms, including mild leg swelling. Besides anthocyanins, blueberries offer modest amounts of vitamin C, vitamin K, and manganese, nutrients that support vascular integrity and have natural anti-inflammatory roles. With a low glycemic index of around 53, blueberries are also an excellent fruit for seniors with diabetes, heart disease, or those managing their weight. And the best part, blueberries are easy to enjoy. You can eat them fresh, add them to unsweetened yogurt, blend them into smoothies, or sprinkle them over your morning oatmeal. With a sensible serving of about 1/2 to 1 cup per day, they make for a safe, effective, and high-value addition to your daily diet, especially for those looking to reduce leg swelling through natural and gentle means. Don't go anywhere. We're about to move on to the second fruit on the must-eat list. 2. Avocado. If blueberries are the purple gems of anti-inflammatory power, then avocados are the soft superfood that nourish your blood vessels from the inside out. For older adults dealing with leg swelling, whether due to poor circulation, reduced kidney function, or chronic inflammation, avocados are a smart choice, both nutritionally and from a preventive health perspective. Avocados are rich in monounsaturated fats, offering about 15 gene per half of a medium avocado, 100. These healthy fats are known to support heart health, reduce systemic inflammation, improve insulin sensitivity, and enhance the elasticity of blood vessel walls. For people experiencing swelling, especially caused by venous insufficiency or increased tissue pressure, avocado's ability to support circulation becomes a key factor in reducing fluid buildup in the lower limbs. In addition, avocados provide a moderate amount of potassium, 485 millimoles per 100, similar to bananas, but with very low sodium content, 7 milligrams. This balance helps the body eliminate excess sodium, which is crucial for regulating blood pressure and fluid retention, both important factors in managing edema. According to the National Kidney Foundation, older adults with normal kidney function should still aim to get potassium from sources that include healthy fats and antioxidants, something avocados do far better than other high-potassium fruits like bananas or cantaloupe. Another major benefit of avocados is their natural vitamin E content, around 2.1 milligrams per 100 grams. This potent antioxidant protects cells from oxidative stress, supports vascular health, and suppresses inflammatory responses in the blood vessels. A study published in the British Journal of Nutrition, 2020, found that vitamin E supplementation was associated with reduced soft tissue edema and improved recovery in patients with mild heart failure and venous inflammation. Beyond being a natural therapeutic food, avocados are incredibly versatile in meals. You can mash avocado on whole grain toast, slice it into salads, blend it into smoothies, or simply eat it fresh with a splash of lemon juice. The key is a moderation. About 1/4 to 1/2 of an avocado per day is ideal to reap the nutritional benefits without excess calories. In short, avocados are not only delicious and easy to digest for seniors, but also a natural aid in reducing leg swelling thanks to their anti-inflammatory properties, electrolyte balancing effect, and blood vessel support. Adding avocado to your daily routine may be a small change, but one that can make a big difference in both health and quality of life. Now let's move on to the final fruit in this list. Number 3, green apples. To wrap up our list of fruits that help reduce leg swelling, green apples truly deserve the title of guardian of digestion and circulation. Not only do they stand out with their pleasantly tart flavor and satisfying crunch, but green apples also offer a nutritional profile ideal for seniors dealing with swelling, thanks to their ability to support detoxification, stabilize blood sugar, and help manage fluid levels. The key highlight of green apples is their abundant soluble fiber, particularly pectin, with about 2.8 gn of fiber per medium apple, or 150. Pectin acts like a sponge, absorbing cholesterol, sodium, and toxins from the digestive tract, while also promoting bowel movements. When digestion is smooth, the liver and kidneys are less burdened, allowing the body to eliminate excess fluid more effectively, an essential factor in reducing tissue swelling in older adults. Even better, green apples have a low glycemic index, GI, of around 39, making them a great choice for those with diabetes, prediabetes, or metabolic disorders, all conditions linked to capillary inflammation and water retention in soft tissues. Unlike overly sweet fruits, green apples help stabilize blood sugar levels after meals, reducing damage to small blood vessels, which is a common contributor to swelling in the lower extremities. A study published in the European Journal of Clinical Nutrition, 2016, showed that daily green apple consumption helped reduce systemic inflammation, improve blood lipid levels, and aid in blood pressure control, factors that play a critical role in managing edema in seniors with chronic conditions like heart or kidney disease. Green apples also provide vitamin C, moderate potassium, 214 milligrams per apple, and flavonoids like quercetin, a powerful antioxidant that strengthens vessel walls, boosts peripheral circulation, and reduces long-term inflammation. Tips for adding green apples to daily meals for seniors. Morning, eat one green apple with oatmeal and a few almonds to increase fiber intake and feel full longer. Snack, slice the apple thin and enjoy it with unsweetened, low-sodium peanut butter for a balance of healthy fat and stable blood sugar. Afternoon, juice green apple with cucumber or celery for a gentle detox drink that supports natural diuresis without disturbing electrolyte balance. Note, always wash apples thoroughly, keep the peel on, where most antioxidants are, and avoid eating green apples on an empty stomach to prevent minor irritation in those with sensitive stomachs. Green apples are a perfect choice for gentle internal cleansing, helping seniors eliminate excess fluids, improve circulation, and reduce leg swelling naturally and safely. Adding green apples to your diet in a smart way not only brings long-term health benefits, but also enhances everyday comfort and vitality. So there you have it. We've debunked some common myths about fruit and swelling and discovered smarter choices for improving circulation through nutrition. While overripe bananas, sweet mangoes, and watermelon may taste great, they're not ideal when your heart, kidneys, or blood vessels are under strain. On the other hand, blueberries, avocados, and green apples offer exceptional benefits, helping your body manage fluids, reduce inflammation, and support overall cardiovascular health. Staying healthy in your golden years isn't about restriction. It's about making informed, intentional choices, starting with something as simple as the fruit you eat every day. If this video has been helpful to you, please click like, subscribe to our channel, Senior Health Master 247, so you don't miss upcoming videos. And share it with your friends and loved ones because a single small action from you could make a big difference in someone else's health. Wishing you continued health and happiness. See you in our next video, where we'll keep bringing you real, practical, science-based guidance just for our senior community.